Thank you very much. May I then move on to the Chief Executive's report? Simon, over to you.
Okay, thank you, Malcolm. Four things I thought I would touch on. The first being the performance of the National Health Service over the last several months. We will have a detailed discussion on this a bit later in the agenda, led by Matthew and Karen, but it happens that our meeting today coincides with the 9:30 release of the monthly performance stats, which is the reason our board papers went up online after 9:30. What they show, of course, is what we all know, which is there has been great pressure across the National Health Service, across hospitals over the November-December period. That's carried on into January and February. So I think the first thing to acknowledge is that those pressures are real, that staff are working under very difficult circumstances, and we should, I think, collectively record our great thanks and appreciation for what everybody is doing. I think that's been very visible to the people of this country, not least through programmes such as the BBC Hospital programme, which has kind of shown some of the real pressures that are out there. Emergency medical admissions were up 2.1% in December this year compared with a year ago. And we've really got two things going on here, which our delivery plan that we publish at the end of March will have to firmly address. At the front end, it's the increase in the number of A&E attendances, and part of the answer to that, of course, has got to be a streamlined urgent treatment centre offer, extended access to convenient primary care, and substantial changes to the way 111 works and is networked with other urgent care services. But really the principal driver of the backing up of major medical admissions and delays in A&E itself is the availability of inpatient beds in the hospital that people are able to admit to, and that the single biggest change over the course of the last year, 2 years and 3 years has been the effective reduction in the bed availability as a result of the fact that social care related delayed discharges have gone up by 90% over the course of the last 2 years. I think this is now widely understood. I think people are mobilising to get a solution. There are discussions underway not only with local government but with central government about that, and that's obviously going to be an important part of the solution going forward. I think just to mention two other related aspects on performance, though, which are perhaps not so widely appreciated. GPs are successfully acting to moderate demand growth for elective services, and the 3-month referral growth rate of just 1.5% is the lowest referral growth rate we've seen in a number of years now, and the referral growth rate is 2/3 down on what it was last year. At the same time, elective activity is accelerating as the year proceeds. So we performed more NHS-funded operations in the period October, November and December than in April, May and June, and that was more, of course, than the year before as well. But as we'll get on to specifically, I think there are a lot of pressures out there, and we can discuss in more detail what those look like. Second point to report is the pleasing news that we've reached agreement with the GP committee of the BMA on the GP contract for next year, and I think this deals with a number of the legitimate pressures and concerns that GPs had, while also ensuring that some of our wider objectives are met, including ensuring that practices are incentivised not to shut for half days on a weekly basis, the small proportion of practices that do that. But we recognise this is just one piece of a much bigger jigsaw of improvement that's needed in primary care, but I do think it represents another concrete step in the turnaround in investment and in changed working practices and services in general practice, and it's pleasing. It's been welcomed by GPs as well as by patients groups. Two topical things that have arisen in respect of general practice, however, that it's worth just noting. there have been reports this week of a practice in Dorset proposing to start offering private charge for appointments alongside its NHS appointments. I think we want to be absolutely clear that it is not permissible for a practice to charge its own register patients, and even the circumstances that have been described here look questionable. So we're going to take a very, very hard look as NHS England at anybody proposing that kind of approach. Likewise, there was a suggestion that individual CCGs might choose to change the national contract in respect of QOF at the back end of this year in Leeds. Legal advice is clear that that would not be possible, and in fact is not the approach that we're going to be taking, given that a lot of practices have said to us that 10 months into the year messing around with the QOF payments would be very unfair and wouldn't actually create a lot of extra headroom for the other pressures that they're facing. Thirdly, just report that we've got various continuing conversations with local authorities. I've been discussing with the Mayor of London, Sadiq Khan, what the next phase of the London devolution agreement looks like, and we expect to be able to make further announcements on that shortly. And also conversations with the West Midlands authorities who've been doing work on health and work and mental health, led by Norman Lamb. And then a number of other local authorities around the country who, as part of the SDP implementation process, are in discussion with us about the role that they might play. That brings me on, fourthly, to the 5-year forward view delivery plan, which we're going to be publishing at the end of March. As you recall, the legal status of this document is it is our NHS England business plan, but rather than that just being for the year ahead, this will look out for the next 2 years, and for some of the deliverables a bit beyond that. It will be a shared effort with other national leadership bodies in the NHS. It is not a bidding document for NHS funding. Instead, what it is taking as the starting point the funding that the government has allocated to the NHS for 2017 and 2018, and then within that saying what realistically can the NHS deliver over that period, both against the usual measures that people are interested in, but particularly on the key priorities that we've previously set out. So on mental health, on cancer, on the other national goals that this organisation has been advancing for several years now, with constancy of purpose, what in practice can be done over the next 2 years. It will also signal very clearly that STPs are here to stay, and a number of us had a very productive session with the 44 STP leads and NHS improvement last week, and coming out of that, I think we will be in the delivery plan clearly signalling that we will be moving towards a formal appointment process for STP leads across the country, bringing together resources that exist at NHS England, together with CCG resources, trust resources, to beef up the implementation capability that exists at STP level, giving them decision rights not only over many of our activities, but also the ability to recommend changes to the configuration or governance of constituent statutory organisations in those geographies where the STP believe that veto power or inertia is getting in the way of the bigger strategic change agenda that is required in that part of the country. So a lot of work going on now around this delivery plan, I think responding to the request from the NHS about realism, about the pressures we're facing, clarity about the priorities, and linking that clearly to a new way of working that brings all of the pieces together to get the job done.
Good, thank you. I've got a proposal to put to the board. We had a very extensive run informally yesterday around the delivery plan. I think we have managed to agree on a number of key concepts and tone and ideas that should go into it. It's also, as Simon said, our business plan, and that is a matter which is reserved to the board to approve. However, it's clear that in the normal schedule of our meetings, we would be anxious for the publication of the report to take place, of the paper to take place before our next board meeting on 30th of March. So what I would propose to the board is that you authorise delegation of final approval to the Chief Executive and the Chair and the Deputy Chair together. But that a condition of that is that we will, throughout the process between now and then, have much further iteration between all members of the board, and I'm proposing that we should bring together certainly the non-executives at a point before publication so that we have a final opportunity to go through the draft report, so that it will not go out to publication until every member of the board is content with it. But I would ask you to approve that delegation so that we have a formal governance structure in place to ensure that we have a proper deliverable product. Are members of the board content with that? Okay, thank you very much. Are there any queries or observation on Simon's report? No, thank you very much.